guys, welcome back to Medical Coding with Blue. Today's episode is all about reasonable productivity rates for medical coding. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I will say this first. These productivity rates I'm talking about today are average, what is considered normal in the industry. I will say this also, is that not every facility is the same. There's going to be facilities that have different needs, and there's going to be different requirements for what you're coding. For some people, they're coding in a clinic setting, and that's kind of what I'm talking about today, is the clinic setting. Now, in a clinic setting, you're going to obviously be coding for your diagnosis codes and evaluation and management, and you may also be coding for major or minor procedures, depending on what happens in that clinic. So with all of this in mind, there's a lot of variables. A person who's coding for the clinic may be coding for all of these things, right? And then a person who's coding for same-day surgeries obviously has to look at a little bit more documentation because they're coding for surgeries, and it's going to lower their production rate. And then if you are only doing the HCC coding, the hierarchical condition category coding, that's only diagnosis coding. So again, that's going to be another variable that changes the production rate. But for illustration purposes today, I am just talking about outpatient clinic coding, all right? Because I have been an outpatient clinic coder for 16 years, and that is what I am used to as far as like production wise. I have worked in same-day surgeries before. It was different as far as production. I have worked in professional fee coding. Now, professional fee coding means that the provider is going up to the floor. That's what I'm talking about. That they're going up to the floor in a hospital, and it's inpatient, but it's outpatient. So that provider is seeing a patient that is staying in the hospital, and they are treating them based on their particular specialty. And I am making sure as the coder that they are getting paid. So in that instance, my production was a little bit lower because I had to do all of the abstraction. So when you are abstracting or doing the abstraction of a record, that means that there's no codes that are pre-selected and that you as the coder are responsible for that. Now that was back in the day. It may be a little bit different for you profi coders now, but back in the day, that's the way that it was. I had to select all the codes. Now with the electronic health record, obviously in computer assisted coding, the provider may select a code or they may not. It really all depends. And maybe you're just doing auditing. Basically, you're checking to make sure that those codes are correct. So these variables can change the amount of records that you or encounters that you are responsible to code for. But again, the illustration of this video is for the clinic setting. So if you are in a clinic, coding for a clinic, sometimes that clinic may require you to code evaluation and management and of course diagnoses. There may be major or minor procedures performed in that clinic. And then also one other thing is the HCPCS coding. So some facilities will pick up HCPCS codes, others will not. It really all depends on what happens at that facility and what kind of information they're collecting as well. So if that's the case, okay, you're coding in the clinic, the average for a clinic is between 80 and 150. Now, this is just the average. There are some places that they say, oh, we want 250. If the average that they want you to code is 250 per day, doesn't matter if you're working in the ER, doesn't matter where you're working. If they say they want you to code 250 per day, that is not coding, that is data entry. And I would strongly recommend that you find another job where they take coding seriously, because you cannot expect somebody who's having to look at the records, pay attention to what's happening, and really accurately code. You cannot expect them to code on average 250 per day in an 8-hour day. It's not going to happen, not even in a 10-hour day. It's ridiculous to push people like that, because that's going to open the door for lots of errors. And not only that, no provider is going to be that good, or no group of providers is going to be that good where everybody is selecting all the correct codes, because they're not meant to be medical coders. That's why we have a job. So that's the thing that I'm going to let you guys know right now, is that some people will argue with me and say, no, that's what I have to produce at my facility, blah, 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 250. Again, are you even coding? because again, that's data entry. So if you are asked to code between 80 and 150, that's good. That means that that facility understands the production rates of medical coders. And if you're coding more towards the 150 side, like the higher end of this, it just means that there's a lot of repetitious coding that happens in that particular clinic. Sometimes that happens. You'll see a lot of the same procedures, a lot of the same diagnoses and things like that. So if that's the case, then that's understandable that you would have something like 150 average per day. Now, a lot of people miss this part where I say average. Average per day means that not every single day that you are working, you are going to be coding for 8 hours straight. Not every day. There's going to be times when you're going to have to back time out of your workload report. A lot of people have workload reports. Some places they don't have workload reports. If you are at a place that doesn't require you to have a workload report, you still need to keep like a journal of what you were doing on a particular day. So that way, in case you're called in and questioned of why didn't you code? What was going on here? Why is there this huge block of time that's showing you not productive? That way you can have your excuse. Sometimes if your facility requires, a lot of facilities, 100% of these facilities will require you to do HIPAA training. And HIPAA training, the average is an hour's time, right? So if you're working in an 8-hour day and you are doing HIPAA training on that day, that means that you spent 1 hour doing the HIPAA training. That's 7 hours of production time that you have to show that you have to, however many records you coded for that day, if the average comes out to however many per hour that they say that they need from you to come out to whatever 150 or 80, then you're in the clear if you did that. Now, if you're showing a little bit lower, they may ask you, okay, what's going on here? If you're having a problem with the provider, or if they're making a lot of mistakes in the code selections, or maybe you're having to query a lot. If you're having to query a lot, you should not be querying a lot. Querying a lot is a big flag that says you need to go spend time with that provider. That provider needs education. And even though they may fuss and go on, if they are not documenting like they're supposed to, if there's a lot of key documentation that's missing, that's preventing you from coding and coding accurately, coding timely, then you need to make time with that provider because they don't understand. And sometimes if they are new to your facility, they may have done it a different way at their old facility. Or maybe there was a coder there that didn't really know what they were doing, or sometimes they are just too scared to talk to the provider. So if that's the case, then you need to make sure that you go over there and you introduce yourself. Now, for my remote coding folks who say, well, Blue, I don't work at the facility. If you are in that area, meaning that you work in the same city, then you need to make an appointment to get over there to go see those providers. Just because you're working at home does not mean you need to be 100% at home. You need to make time to be in the facility as well so they can see your face. A lot of times when providers get lots of queries, they're going to stop listening because, first of all, who are you? I don't know who you are. And you're sending me a bunch of queries telling me I'm doing things wrong? No. And they're not going to listen. So it's a lot harder for them not to listen to you if they know who you are, right? So if you go over there and you're, introducing yourself, you're trying to offer education, maybe you can schedule some time to do an in-service in person better than virtual, because again, virtual is not the best way to provide education for providers. Is it more convenient? Absolutely. But is it better? No, it's not, because being in person, you can get a read of the room and you can see how they're reacting to your education. And investing that time into educating them so that they can document appropriately and properly is going to help you to become a faster coder, which means that you will be able to hit your production standard a lot easier. And that's going to give you more time to be able to dive into some of these more challenging records that you may come up against. So that's something that it can affect production. But again, if you are showing slightly under, and then if you say, well, it's because I did, an hour's worth of queries, then that's the thing that you can put onto your workload report as well. And of course, you're going to have to show if they investigate, did you really do this many queries? And then you can let them know, well, I sent this provider 5 queries, I sent this provider 6 queries. You can write that on your little journal log, So that's something that can kind of cover you. You want to be able to show that you have been actively productive. And again, some days you're not going to always hit your production because some of these records may be a little bit harder. And if that's the case, it's okay. You can always make it up the next day. But if you continuously slack off and, you're playing on your phone or you're distracted because you're working at home, it's going to show really quickly. And that's a reason for them to counsel you, for you to lose out on bonuses and things like that. So you don't want to get wrapped up in that. You get paid to be on the clock and work. All right. So you need to show that you are being productive. I'm just saying. So with that said, again, between 80 and 150, this is showing that this organization knows and understands that coders need time to look at these records, and they need time to be able to look at them to make sure that everything is there. And then if not, then they need to allow you to, of course, have the time to query and have the time to educate those providers, because that is part of our job as coders, is to do education. Now, sometimes in some facilities, they will have a coding educator on staff. Sometimes they'll have a coding lead who does the education. If that's the case, then obviously what I just said does not apply to you. But if you don't have that at your facility and it is on you, then that's where you need to pick up those reins and start learning how to communicate and communicate well, because that's what this field requires. Okay. And again, spending time to educate your providers is an investment in your production time, because then you're able to start producing well and quickly. So that's one of the things that you ought to know. But again, I go back to that it's different for every facility. And again, different settings are going to require different amounts to be done. If you're working same day surgeries, they may require you to only produce 50 per day. It really all depends on that facility and how complex those procedures are. All right. So they're going to look at all of these things. If you are getting to a point where they say the production is really high, like I said, anything over 150, it's ridiculous. I mean, that's just speeding through encounters or really relying on the provider's code selections. And a lot of times those code selections are not correct. A lot of times they're not. Sometimes they are. Sometimes you can get really lucky. I've had the pleasure of working with a few providers who got really good after I had done a lot of education with them. And they started to document really well. And so that I could select these codes quicker, or sometimes they selected the codes themselves. And it was just right on the money and I was able to speed on through. But it really all depends. And you can get there, but you have to, invest that time. But that's just one of those things. So when it comes to your production, as long as you're eliminating all of your distractions like the phone and talking on the phone. You should not be talking on the phone, period. There are some people who will sit there all day long, be talking on the phone or trying to be texting with whoever, and then they complain that they're not able to hit their productivity standards. Well, that's a you problem, because those productivity standards are worked out. And if everybody else can hit it but you, because you're distracted, then that's the problem right there. So they take these things very seriously. They take the production. It has to be the way that it is. Again, if it's reasonable, and it has to be met. And there's going to be some days where you can do more than what is expected. And there's going to be some days where you are going to do less than what is expected because it's a little bit more difficult, or something changed, or something happened in the electronic health records. Sometimes information doesn't always cross over, okay? And so because of this, it can lead to a lot of other problems. So there's a lot of variables, but keeping track and being consistent with your productivity is a good thing, all right? And getting good with production requires you to study offline. It requires you to study at home for your particular specialty. Getting really proficient with your specialty is going to be another key to being able to meet your production and exceeding those production standards as well. Okay, but not to like 250, 325. Somebody said that they were required to do 325 per day in the ER. I said that's not coding, that's data entry. That's data entry, and you are responsible for the codes that are selected. And so if you are looking at these codes and you don't agree with these codes, you need to change it to whatever it is that's reflected in the documentation. And if you don't, that can lead to a lot more trouble on down the road. So you can't just push these codes through to go along to get along, because that's not going to work either. Okay, we are all held to ethical standards, and you can look at the AHIMA standards of ethical coding, AHIMA standards of ethical coding. Everybody's supposed to follow this regardless of credential status. So that way we know these are the rules. And it says there that you have to stand up and say something if something is incorrect. If you're being told by your auditor, hey, we coded this way and there's no proof of why, then you need to speak up, and you need to go through your chain, your chain of who you have to talk to next if you don't agree about something. Okay, it's very important to be an advocate for the things when it comes to coding, because ultimately the codes that you are selecting is going to be billed to somebody, and that person's going to have to pay. And if that patient is already sick as it is, and you're selecting the incorrect codes, you're making that patient pay either more or pay less than what they should. And that provider loses out. When the provider starts to lose out, it's a trickle-down effect, because now the provider's losing out, then the facility loses out. The facility loses out, then they can't, they're not making the appropriate amount of money to be able to hire new staff or get equipment or buy supplies. So again, it's very important that the coding is accurate. So regardless of productivity, that needs to be secondary always to accuracy. Accuracy always comes first. Now, I'm not saying that you have to spend 5 hours for every single encounter, but what I am saying is be reasonable. If you're looking at an encounter and it requires you to spend a little bit more time, it requires you to spend a little bit more time. If you are procrastinating, or if you're doing other things that are affecting your ability to be able to complete an encounter in a timely manner, then that's a you problem, and it's going to become a you problem with the facility or the organization really fast. So you don't want to do that. Okay, so just make sure that you are doing your part. Do your part and make sure that you are remaining productive and things like that. If you need help and maybe you don't understand something about how to code a particular situation, if there's an educator there, like a coding educator that you're supposed to ask, try them first. If not, you really should be trying to do your own research. There's a ton of resources out there, guys. There's books everywhere, like workbooks. There's the organizations, if you're with AHIMA or AAPC, they both have discussion boards that you can go to if you're a member, and you can talk about your questions and things like that. And sometimes the questions, when you ask them and somebody gives you an answer, don't just take their answer. Always verify the answer before you go and you start implementing this yourself, because again, you don't know that person's background in their education. If they're going to point you in the right direction, then that's great. But sometimes that's not always correct. Like some of the things that I have seen before on some of these chat boards that are out there on the internet, like you can't really respond to them because these chat boards are already closed. And I'm like, why would you even suggest that? So always look at those things. You have to learn to do your research, okay? But again, if you need it explained to you and there's somebody on staff, then you need to ask and be direct. And you need to show them that you've already attempted to figure this stuff out by yourself. Because if you're not, and you don't do that, that person, that coding educator is not going to have as much patience for you because you didn't try to figure it out on your own. There's a lot of people that don't want to train new medical coders or don't want to help them because no one was there to help them. Now, I don't think that that's right, but it does happen, okay? And because a lot of new people, there's a lot of new people that are very dependent on other people to tell them what to do. You can't do that. Not in this industry. This industry requires you to do your research. Okay, so that's just what I want to say about that and being productive. Okay, but again, if you're a little under your productivity, you need to look at why. If obviously if the production is reasonable, then you need to look at why you're not meeting production. Is it that you have to query the provider a lot? If you have to query the provider a lot, then that means you need to stop and take the time to educate them so that we can stop the queries. Because the anatomy of a query is 1 hour. And when I say this, is what I mean is this. It takes, you're looking at the record. And then you have to decide on like, okay, if you're going to fill out a template on your query. So all that time is about 15 minutes. Then you got to send it to the provider. Then the provider messages you back. And sometimes they're not always going to answer your query right away. So you have to kind of keep on top of it. Then if they do, sometimes they want to sit there and fight back and be like, no, it's this and this and this doesn't make sense and blah, 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 not going to do this and whatever. So then you have to come up with even more reasoning for like why you sent them the query or what the regulation is for, you know, what you're asking them and things like that. Because sometimes they'll say, why do I have to have this? Well, here is the regulation on why you have to have this particular thing in your note. And so if that's the case, that's another 15 minutes that you're having to sit there and come up with a response. Then you have to wait again for them to either correct it or not correct it. And if they don't correct it, then you have to go further or send it up your chain, or you have to think of how to say it in a different way so that maybe that they'll understand what you're trying to say. And then by the time they come back, okay, well, I'll go ahead and fix this. Well, then you just spent 45 minutes already. Then you got to go back in and you got to find that record. You got to go and you got to update the codes, and then you got to submit it. That's another 15 minutes. So that's anatomy of an hour for one query. So that's why I say you have to make your queries as little as possible. I've gotten my providers where it's very hit and miss now that I have to do any queries. And queries is only because they forgot something, you know? So that's the thing. That when you're doing these queries, you can get to that point where you're not having to do a lot. But it really all depends on you and how committed you are to educating them. If the fact that you say, well, Blue, I think I'm not meeting production because I'm reading too long or I'm taking too long to get through the encounter, it will take you time to build up your reading speed. But if you have been doing things, again, offline to help you while you're coding in the clinic, like reading, actually reading, not listening to something, but reading. When you take the time to read, reading is a muscle. And the more you work this muscle, the faster you will get. And that's going to be one of those things that's required of you when you're reading. And if you don't read all day, I mean, if you don't read at home and you're trying to read at work and reading is not your favorite thing to do, obviously you're going to be slower. But if you start reading things that you like in the evening, and then you build into learning more things in reading, like reading the coding guidelines, hint, hint, then that will help you with your production, because then you'll become a faster reader. You'll be able to process the information in your brain a lot faster, and then you'll be able to get through your encounters much more quickly and much more efficiently. So that there's a lot that goes into it, and it's not just building professionally, but it's also building personally. And taking the time to practice your reading is going to help you with that production. Okay, so that's just what I'm saying. If you hopefully this makes you understand why production is the way that it is, and with you making sure that you're improving on your own with your knowledge, that's going to help you. And it's not just the reading, it's the coding as well. So my advice to you would be this also, to get the diagnosis coding book, especially if you work in like the ER where they require you to know a lot about injuries. If you have the Optum book, you can look in the injury chapter, and in the beginning of the chapter in the Optum ICD-10 CM Expert for Physicians, that's the one that I recommend. If you look at the beginning of that chapter, you will see that there's examples of, injury coding, and there's explanations as well. So that's going to help you if you have that Optum book. It will help you to understand how to do those. Cover up the answers, take the time to practice those. Again, the more practice that you get, the faster you're going to get at work, and the easier you're going to be able to reach your production standards. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.